Dental Hygiene Basics podcast. My name is Dana. I am your host, and as always, excited to be here. It is a rainy, stormy day here in San Antonio, which I feel like never happens, but we've actually been having a couple of weeks of storms, which is really nice. So right now for me, I know you probably won't hear it. There's a nice little lull in the background, and I just feel like it's the perfect day to record a podcast. I want to talk about something that I've been thinking about for a few weeks now, and it's actually the Maslow's hierarchy of needs. When you get into dental hygiene school, or maybe if you've been in psychology or sociology classes, you may have come across this, but it is something that we do usually cover and learn in dental hygiene school. And why is that? It's because this is a framework that explains human behavior by organizing needs into levels. As humans, we all have needs. And I know that you know that we have some very basic needs that must be met, right? We need to have food, we need to have water, we need to have shelter, we need to have sleep. Those are core needs that are absolutely necessities for us to live and survive. But those are also core necessities for us to thrive as well. We have needs that extend even beyond just that little, basically they're called physiological needs like sleep and eating and food and water and all that fun stuff. But there are needs that extend beyond that. And that's really what Maslow's hierarchy of needs breaks down at the base of these needs. So if you can envision basically a pyramid in your head, or you could Google Maslow's hierarchy of needs and see a little pyramid of this. And again, this is commonly taught in dental hygiene school. So I think it's this will be a little review session if you have covered it already. And if you haven't, a little precursor to what's to come. Usually we learn about this when we are going through like a community class, or maybe even motivational interviewing, learning how to get your patient to change their behaviors for the better, right? Because we know some patients don't brush, they don't floss. Well, how are we going to get them to start implementing those things? That's when we start thinking through these behaviors of change and how we motivate them, but also what may stand in the way of those patients changing. Okay, so again, when you are thinking about the Maslow's hierarchy of needs, I want you to think about a pyramid. And at the bottom of the pyramid are physiological needs. Those are the things we've already talked about, the things that we know that you need, like sleep, food, physical well-being. And then just above that is safety. Okay, safety also includes financial stability, mental health, a sense of security. If you don't feel safe, it's really hard to elevate to the higher levels of this pyramid. Above that, we have love and belonging, followed by esteem, like confidence and competence. And then at the top, we have self-actualization, which is growth, learning, and reaching your full potential. The thing is, the most powerful part of understanding Maslow's hierarchy of needs is that we tend to focus as humans on the lowest unmet need first. And it's really hard to rise to the top of the pyramid if you have needs that are unmet. Now, that's not to say you can't occasionally jump a level. But with that being said, we tend to see long-term effects if you're constantly jumping a level. Okay, so if you're exhausted, overwhelmed, or maybe you're feeling unsafe, your brain is not going to be able to prioritize growth, learning, behavior change. It may to an extent, but it's going to be much more difficult. It's really going to feel kind of stressed out, burnout, until you figure out how to stabilize those lower levels of the pyramid first. Okay. So again, where does this show up in dental hygiene school? We usually introduce this in the context of patient care, patient behavior. You're taught that if a patient is struggling to meet their basic needs, so imagine a patient comes into your office, they have pain, right? And they're there to get the pain addressed. But while they're getting that pain addressed, they're in your chair and you're telling them, oh, you have a ton of plaque buildup and you need to brush and floss and implement this and do that. If they are struggling to meet a basic need. Like, let's say that they're there to get the tooth addressed, but really they're struggling to even find food, right? Or getting enough sleep or something like that. Or maybe, they just got evicted from their apartment. If a basic need, a physiological need is missing, they are far less likely to prioritize their oral health, right? So think about it. If you didn't have a place to live, would you be concerned if you were brushing your teeth morning and night? If you're a dental hygiene student, maybe, right? Or if you're a dental hygienist, maybe, but there's bigger fish to fry. Okay. And so whenever we're having these conversations about recommending oral hygiene and stuff like that, we have to enter those conversations with empathy and awareness because we truly do not know what other people are going through. I I always feel like I am an empath and I do try and consider other people and what they're experiencing. But I really did not get better at this and truly see the big picture until me, myself, started going through some serious health struggles. And I was, struggling every single day. I had severe chronic pain. Um, if you've been listening for a while, you'll know that I was eventually diagnosed with really advanced stage endometriosis with a lot of negative symptoms and side effects. And I was struggling to do a lot of things. Okay. So, I envision as dental hygienists, we're like, why won't they just brush 2 times a day? There were some days that it felt like I couldn't even physically hold a toothbrush. You know what I mean? And I'm a dental hygienist. Okay. I know what I should be doing. And then I'd be beating myself up over it. I'm like, I can't even get out of bed to like feel like I can floss. And I know the things to recommend. Oh, I should keep floss by my bed. I should keep a toothbrush by my bed because I'm so tired. But sometimes we're so tired you can't even overcome those things. Right. So that really became more clear to me after I had my surgery for endometriosis. And I realized how hard I had been struggling for so long. And to many people on the outside, they did not know that I was struggling with this. I would show up to work every day. I never called in sick for work for this. I was smiling, I was performing a lot, just showing up, trying to get the job done, take care of my students. But I was really, really struggling. And I remember one day I had to cancel a dental hygiene appointment. I was going in to get my teeth, excuse me, going in to get my teeth cleaned, and I had to cancel last minute because I was having so much endometriosis pain. And I felt so guilty because I know what it's like when the hygienist is sitting there waiting for you. You have a last minute cancellation. It's so frustrating, right? But it made me see, especially again, kind of looking at it hindsight, we don't know what our patients are going through. I would have never envisioned a world where I would have to, last minute no show an appointment, but that was my life in the moment, and I had to make that decision. My lowest, most basic need was to be home, to be safe, and to manage my pain. Okay, I could not achieve a higher level in that moment. If someone you're looking on the internet, like for me example, I'm like, how do I help with endometriosis pain? Looking up all these things, and a lot of things are like, oh, eat really well. Okay, I was eating, but it was hard for me to even eat really good food. Like to prepare a meal was exhausting. Okay, and I still have some of these issues like chronic fatigue, chronic pain. So I'm not out of the woods, but again, it just gave me a different perspective. So if you have a patient, who's missing appointments, they're not following through, or, you label them as non-compliant, maybe they are non-compliant, but we don't know what they're dealing with. They may be dealing with stress, financial limitations, childcare challenges, mental health struggles, chronic pain. From that perspective, it can make sense why something we think is so simple, like brush 2 times a day, or, oh, just add flossing into your routine 1 time a day, that might not be their top priority, right? If they don't know if they're going to have money to cover rent, flossing is not their priority. Okay. So I want you to kind of shift your thinking from why isn't the person doing this? I'm making these recommendations. They're making my job harder, right? To really thinking, well, what might actually be in the way of preventing them from doing this? And that's a question that it is okay to ask. I have had instances where a patient, they were really, really struggling, just exhausted. They were a nurse and they were working tons of hours, and, their oral hygiene was terrible. And I tried every angle, you know what I mean? I'm like, well, you're a nurse, you understand, systemic health. This is how the oral cavity relates to systemic health. As you have all of this stuff on there, it may increase your risk for heart attack, stroke. She could not be scared into compliance. Okay. She was simply just freaking tired. She was overwhelmed. She was exhausted. So we finally got her brushing in the shower. I was like, look, do you take a shower every day? She's like, yes. I'm like, put your toothbrush in there. I want you to brush. I don't even care. 20 seconds, but you got to do something, right? We got to try and make a change that you can manage. I don't even care if you're laying down in the shower, a depression shower, brushing your teeth on the floor of the shower, whatever we got to do. And she was able to do that and implement it. But we did pretty good for a few months. She was coming in every 3 months. And then she kind of fell off again, right? Things got busy, things got stressful. So we can't expect our patients to be perfect every day. We aren't perfect every day. You know what I mean? I know the things I should do on a daily basis to stay healthy, and they're hard, especially when life gets crazy and stressful. So That's a good little refresher on Maslow's hierarchy of needs. I also want to flip it and talk to you about how you can apply that same lens to yourself as a dental hygiene student. You are expected in dental hygiene school to operate at the top of the pyramid. So remember, the very top of the pyramid is self actualization. And that is where a lot of growth, learning, reaching your full potential occurs. Okay. But with that demand, that high level of thinking, that can be really challenging if you're struggling with some of the areas on the pyramid that are lower. If you're struggling with finances and you're not sure how you're going to pay for the semester, do you think you're going to be able to focus in class and pay attention and operate at your highest level? No, because one of your basic needs is not being met at the moment. Okay. Just a little plug. We have the Dental Hygiene Basics Scholarship. Okay. Head to my website, dentalhygienebasics.com / scholarship. You're going to find our scholarships. Okay. So if you're struggling with finances, please go apply for the scholarship. Look for scholarships. And let's think of some other things. Okay. What do we usually give up in dental hygiene school? Eating healthy, sleep, right? If you're sacrificing sleep to study more, that is probably actually having the opposite effect. It's not allowing you to reach your highest level because you're sleep deprived. And when you're sleep deprived, you really struggle to download information into your brain, to hold on to it, and to think at your highest level. Okay. So again, if we're thinking through physiological stress, you're running on little sleep, inconsistent meals, you're physically fatigued, right? Clinic, pre-clinic, all of those classes, they may seem so simple, right? But it is mentally and physically exhausting. So we have to fill in those little basic physiological needs. Don't let those go by the wayside while you're in dental hygiene school. Okay, so then the next level, safety. Again, if you have financial stress, that can be playing into you not achieving your highest levels. Fear of failing, pressure to perform, you feel not safe, right? Performance anxiety is a real thing. And so if that is something that you're really, really dealing with, that's really impacting you, it's going to prevent you from reaching your highest level because it's like a roadblock, right? It's like a hurdle. So then the next thing we have is belonging. This is something that can be big in dental hygiene school because you may be comparing yourself to your classmates. You may be feeling isolated if you're struggling to connect with your classmates, or you may feel like everyone else is getting it and I'm not getting it, right? That imposter syndrome. Or you may even be feeling like I am not good enough, right? Like I'm just, I don't know. I don't know what I'm doing here. Why am I here? Right. So all of those little feelings of imposter syndrome may sneak in, and that can affect your feeling of belonging as well. Not to mention how all of these things pile up to affect your self-esteem. Okay. So if you keep having struggles on your exams, or struggles in clinics, or you feel like, oh my gosh, I'm just always getting in trouble from my instructors. It's one thing after another. That starts to knock down your self-esteem, right? And I always think if self-esteem is messed up, like we start to see boom, 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 like the dominoes fall, where everything else starts really breaking down as well. So if any of these basic needs are not solid, then everything above it feels way harder than it should. Okay. So if you're going through dental hygiene school and you're asking yourself that question, like, why does this feel so hard? It feels so difficult. I can give you the old runaround. Well, it's just because dental hygiene school is hard. It is hard, right? We already know. We talk about this all the time. Why dental hygiene school is hard. It's because you have, clinic. You're juggling patients. You're learning so much material. You have quiz, tests, projects to do every single week. It just feels like an onslaught of material every single day, and it can be really easy to get overwhelmed and to feel behind and to feel scared. And you're learning all new things, which puts you into that driver's seat of discomfort, right? And you don't know where you're going. You're on a road, and you're just like, I'm driving, and I don't even have a driver's license. That's how you're going to feel a lot in dental hygiene school. Okay. It's easy to start to let the pyramid of your needs fall apart. And I don't want you to do that. Okay. So remember, if things are feeling harder than they should, I really want you to check in with yourself. Did you drop off some of your basic needs? So if you're struggling, it's always worth asking, am I consistently sleep deprived? Am I getting good enough sleep? It is okay to put the brakes on studying at a certain time and prioritize sleep. However, you got to do that. Okay. However, you got to get the sleep. That is the most important thing. Okay. We can barely survive a couple of days without sleep, right? It really starts to mess with you if you have chronic lack of sleep. Am I overwhelmed to the point that I can't think clearly? I see this in students all the time. They're in the clinic and I'm like, okay, what comes next? What do you need to do for your next step for your patient? And they can't even, they're looking at me with the crazy eyes, right? And oh my gosh, it breaks my heart when I see that, because I just know that they're so overwhelmed that they can't even form step one, step two, step three. So slow down, create goals for yourself, create routine for yourself, right? And as you're getting the hang of that, just know that you've got to prioritize yourself and your needs at the top of that schedule. Okay. Whatever that looks like. Does it mean that you're going to have 8 hours to journal and exercise every single day and to, eat, pre-cook like all these meals? No, that's not going to be an everyday thing. But can you prepare ahead? Right? Maybe on Sundays you meal prep. Maybe during the week, to get some exercise in, you're going to go for a walk around the block while you listen to a lecture with your podcast, right? How do we start to habit stack and kind of combine a few things to make your life easier? It's a short-term sacrifice, right? Okay, I'm going to spend maybe 2 hours meal prepping on Sunday, but again, maybe I could listen to a lecture and study at the same time. Or maybe I'm just going to watch TV while I do that and knock out my self-care and my quiet time while I'm, creating meals for myself to take good care of myself. So how do we start to implement just these little bitty changes, into your week so that you can cover your most basic needs? Okay. If you're constantly feeling behind, unsafe, anxious, like you feel like, oh my gosh, I'm going to fail, I'm going to fail out. If you're looking at your grades, and remember, your grades are a direct reflection of how you're performing. If your grades aren't looking good and you're panicking, reach out for help, right? I mean, us here at Dental Hygiene Basics, we have tutors. We're here, even if you just need to unload, type it all out in an email. Don't even worry about what it says. It could sound like a crazy person. Send it to me. Send it to me. Okay. Send it in a DM. Get it off your chest. Okay. And I'll do my best to respond back in and give you just a little bit of encouragement, a few action pieces. Okay. If you're really struggling, you can head over to my website, dentalhygienebasics.com. You can sign up for the newsletter where we kind of stay in touch with you guys regularly, sending you a bunch of information. But also I have something called the Dental Hygiene Hurdle. Okay. It's also, you can find it in the show notes, but the dental hygiene hurdle is just that little push. If you're really stuck, if you're really struggling, it's just that little push to get you over that hurdle. Okay. That's a free guide if you're interested in that. And then maybe you're asking yourself, have I lost confidence because things just aren't clicking, right? Is everything else okay? But I just am not feeling there. You're like, okay, I'm sleeping, I'm eating, I'm safe, like I've got finances underway, everything's good. But I don't feel confident, and it's okay no matter where you're at on this pyramid. If something's not stable enough to support the level that you're being asked to perform at, it's okay to reach out, get help, ask that, and talk to your professor. Say, this is how I'm feeling, right? This is how I'm feeling. Talk to somebody about it, because the more we hold it in, what we start to do is we may start to feel shame. Why am I not able to do this? Right. And I heard recently, and I cannot remember where I heard this, but I thought it was so great. I can't even say it. Shame shields solutions. Shame shields solutions. So if you're holding on to this quietly and all you're doing is just, mentally berating yourself, like, oh, why can't I do this? I'm so embarrassed. Everyone else is getting it, but I'm not. Shame shields solutions. I want you to pull yourself out of that mindset and figure out what is the solution, and start from the bottom of this pyramid, right? And look at, am I meeting my physiological needs? Am I meeting my safety needs? Do I have love and belonging? Do I have self-esteem? If I have those things, or if I don't, where do I need to figure out what to fix in order to move up to the highest level, that self-actualization, so that I can achieve my fullest potential? Again, we can work through different levels of this pyramid at different times. There's people out there who have risen from extreme poverty, right? And they go on to do something amazing, right? We can do incredible things. Humans are fragile, but so resilient. It's incredible. And when we have grit and tenacity, we can do a lot of things that we put our minds to. With that being said, we could do a lot more, a lot better, a lot faster if we manage our needs before we try and push to the finish line. It's not to say some things can't coexist, but I'm saying this through my own experience. For years, I was like, "Oh, I'm crushing it. I'm growing. I'm, expanding. I'm building my business. I'm, doing all these things." But what gave out eventually? My body, because I did not prioritize those lower level needs. I got extremely stressed, burnt out, exhausted. I'm still dealing, like I said earlier, with chronic fatigue where I just crash out. I mean, I do not have the energy levels that I used to. I would say I never had great energy levels before, and now it's a whole other ballgame for me. But it's better to rise through those levels and consistently keep checking in to see what needs are not being met right now and how can I meet them so that I can be my best version of myself. It is okay to put yourself first. When you do that, you will see that you become a better person for everyone around you, for every situation that you're in. You're going to be able to pull people up out of their lowest levels, right? You're going to be able to give them that belonging, and your patients are going to feel that, right? So it is okay to prioritize yourself and to take care of your needs. All right. I hope that you got something great out of today's podcast. And once again, if you're struggling, shoot me a message. Like I said, I don't care what it says. It can sound legit crazy. I won't think you're crazy. We have all been there. But I am thinking of you today on this rainy day. I hope you're somewhere warm and sunny and enjoying life. And best of luck on your journey, future registered dental hygienist.